First, I'm going to start by scanning the room. Hi, my name is Kelsey Bean. I'm a graduate nursing student at West Texas A&M University. I'm going to be conducting a head-to-toe physical assessment on a 30-year-old male who has come to the clinic for a general exam. Prior to this, I've completed the general survey, obtained vital signs which were within normal limits, tested the cranial nerve number 2, which was the optic nerve with the Snell and E chart, assessed for drug allergies. He has no known drug allergies, obtained past medical history, surgical history, social history, family history, and he also established chief complaint, which he has no chief complaint. I've obtained his height and his weight, and his BMI is within normal limits. It's normal. I have washed my hands, and so now we're going to begin the exam. I'm going to straighten this out. Alright, so first we're going to start with the general inspection of the head and the neck. I'm going to be looking at the scalp, making sure that it is nice and intact. I'm going to be feeling the texture of the hair, feeling for any bony nodules throughout the skull. Now I'm going to move on to the sinuses. So I'm going to be palpating the frontal sinuses and the maxillary sinuses, just assessing for any tenderness the patient may be experiencing. I'm going to now move on to the temporal pulses. I'm going to be checking them bilaterally, ensuring that they are 2+. Okay, great. And while I'm here, I'm going to go ahead and palpate the temporal mandibular joint. I should be able to fit about 2 to 3 fingers in between this joint. If you could open your mouth for me. Move it side to side. All right, and right here I'm just assessing for crackling noises or discomfort that the patient may be experiencing. I'm also going to assess that the eyes are symmetric, the ears are symmetric, the nose and the mouth are within midline. I'm now going to be assessing cranial nerve number 5, the trigeminal nerve. All right, if you could just tell me if you feel sharp or dull.
Okay. Dull. Sharp. Dull. Sharp.
Okay, great. Okay, so now I'm going to take a look at the eyes. First I'm going to look at the conjunctiva, just making sure that they are pink and they are moist. I'm also looking at the sclera of the eyes, making sure that they are white. They're not yellow, showing any signs of jaundice or that could indicate liver disease or dehydration. Now I'm going to test cranial nerves 3, 4, and 6. The ocular motor, the trochlear, and the abducens with the 6 fields of gaze. So if you can just follow my pen light and not move your head. Okay, and that's just assessing for nystagmus or jerking of the eye. I'm also going to test direct and consensual. Direct, consensual, direct, and consensual. And now I'm going to test the optic disc red reflex. So with this, I'm going to be looking for any papilledema or abnormalities. I'm going to brace my hand against the patient's forehead, just for stabilization. Okay, and no abnormalities were noted. Okay, and from here, I'm now going to move on to the ears. I'm going to be feeling the back of the auricles, just ensuring that there's no nodules, masses, or anything, any type of tenderness. And I'm going to take a look in the ears. I'm assessing the tympanic membrane to make sure that it is intact. There's no redness or swelling. And for the adult patient, I'm going to pull out and back. I do note some sebum wax, but nothing abnormal. Now I'm going to be testing the acoustic nerve, which is cranial nerve 8 with the whisper test. If you could just repeat what you hear.
55. 66.
Okay, great. Now we're going to move on to the Weber and the Ryan test. With the Weber test, I'm just going to be testing lateralization, making sure that hearing is even on both sides. So if you can just tell me if you feel vibrations evenly.
Okay. Yes.
Okay. Now we're going to do the Ryan test, and this is just testing air to bone conductivity. So if you can just tell me when you stop feeling the vibration and hearing the ring.
Okay. Okay.
Okay, and that should be 2 to 1. We'll do the other side.
Okay. Okay.
All right, and now we're going to move on to the nose. Okay, so first I'm just assessing the nares, making sure they are symmetric. I'm also looking at the nasal septum, making sure that it's not deviating to one side or the other. I'm going to take a look at the inside of the nostrils and just looking for any type of nasal polyps or lesions. I do not see any. Now we're going to test patency of both sides. So if you can just take a nice deep breath in for me. Okay. Another nice deep breath in for me. Okay, great. Now we're going to test cranial nerve number 1, the olfactory nerve. You can just close your eyes and we'll test each side. Just tell me what you smell on each side.
Okay. Hand sanitizer.
Okay. We'll test the other side.
Hand sanitizer.
Okay, great. Alright, so now we're going to move on to the mouth. So first I'm just taking a look at the lips. I'm just ensuring that they're pink and moist and there's no signs of cyanosis or cracking, dryness that could indicate dehydration. Now I'm going to have you open up your mouth. And looking at the soft and the hard palate, I'm also looking for any oral lesions, any ulcers. I'm going to look on the side of the tongue and the other side. I'm going to look underneath the tongue, looking for any cancerous lesions and on top of the tongue. Okay, great. All right, so now I'm going to test cranial nerve number 9, the glossopharyngeal nerve. If you can open your mouth for me. And this is the gag reflex. Okay, and the patient had an appropriate response. Okay, so now I'm going to have you open up your mouth one more time and say ah. Okay. And I'm just making sure that the uvula rises in its midline. I'm going to have you open up your mouth again. Stick your tongue out. Once again, I'm just assessing for ulcers. And that is also testing cranial nerve number 12, the hypoglossal, and assessing the uvula of this cranial nerve number 9, the vagus nerve. Okay, so we're going to finish up with the cranial nerves. I'm going to test cranial nerve number 7, the facial nerve. So if you can just smile for me, puff out your cheeks. Okay, and now we're going to be doing cranial nerve number 11, which is the spinal accessory nerve. If you can just shrug your shoulders against my hands. Okay, great. All right, so now we're going to move on to the neck. First, I'm just going to take a look at the trachea, making sure that it is nice and midline. It's not deviating to one side, which could, indicate some sort of labor distress, respiratory distress. I'm going to come on the back of the patient. I'm going to palpate his thyroid. You can just swallow for me. Okay, and right there I'm just feeling for any nodules or lumps, masses, assessing if the patient is experiencing any discomfort. Now we're going to move on to assessing the lymph nodes. So we're going to do pre-auricle, post-auricle, submandibular, submental, cervical, post-cervical, supraclavicular. And I'm going to go ahead and do axillary at this point, so if you can just raise your arms out for me. And right here I'm feeling for any nodules, lumps, or edema or fluid. Okay. Alright, so I'm going to palpate now the carotid pulses. I'm just going to be palpating to ensure they're 2+. I'm going to do them one at a time. Okay. Perfect. Now I'm going to auscultate the carotid pulses. I'm going to be listening for whooshing sounds or bruise. If you could take a nice deep breath in for me, let it out and hold. Use the other side. Take a nice deep breath in for me, let it out and hold. Okay. No whooshing or bruise were noted. Alright, so now we're going to go ahead and move on to the posterior chest. So you can go ahead and take your shirt off, and if you'll just face towards the window. Alright, so first I'm going to do an inspection of the back. I'm just making sure that with each respiration we have a nice rise and fall. I'm also looking for any type of distress, any type of labored breathing. First, I'm going to check chest expansion. So I'm going to place my hands on the patient's back and have you take a nice deep breath in. And I'm watching my thumbs rise and separate evenly. All right, and so now I'm going to palpate for costovertebral tenderness. Did you feel any tenderness there?
No.
Okay. Any tenderness there could signify some sort of infection in the kidneys. Okay, so now we're going to palpate for tactile firmitus. So if you can just say 99 for me with each palpation.
99, 99, 99, 99.
Okay, great. Now I'm going to percuss over the lung fills. I'm just listening for dullness, dullness over the lung fields, hyperresonance, which could mean fluid in the lungs, or dullness, which could mean fluid in the lungs, or hyperresonance, which could mean an overexpanded lung, like in COPD or asthma. Okay, now I'm going to percuss for diaphragmatic excursion, getting to that point of dullness. So if you can take a nice deep breath in for me, let it out and hold. Okay, take a nice deep breath in, hold it, and you let it out. Okay, and I would measure right in between there. Now I'm going to auscultate the lungs. I'm going to be listening for adventitious lung sounds like rhonchi, crackles, wheezes. And I'm going to do this in a ladder-like motion. Take some nice deep breaths in. lung sounded clear. Now I'm going to test for bronchophony, agophony, and whisper pectorally. So if you can just say 99 for me.
99, 99, 99, 99.
And say E.
E, 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 E.
Okay, great. All right, so now we're going to do the anterior chest. So you can go ahead and flip around. All right, so first I'm going to do a general inspection, making sure that I have a good, nice rise and fall with each respiration. I'm also going to do a comparison of the anterior chest and the posterior chest, just assessing for a concave or barrel chest, and this patient does not have either of those. Okay, so now I'm going to palpate with the pats of my fingers and the ball of my hand, just for any thrills. And I'm also going to palpate for the point of maximal intensity. I can feel this patient well. If he had an enlarged heart, I would go more away from the midline. Okay. So now I'm going to percuss the anterior lung sounds once again, listening for hyperresonancy. Listening for resonant lung sounds. Okay, and now I'm going to go ahead and take a listen to the lungs. I'm going to auscultate for adventitious lung sounds like wheezing, rhonchi, or crackles. So take some nice deep breaths in and out. I'm also going to listen for lateral lung sounds as well. Okay, great. So now we're going to move on to the heart. I'm going to be listening for heart sounds at the second intercostal space right of the sternal border aorta, second intercostal space left of the sternal border pulmonic, third intercostal space left of the sternal border, fourth intercostal space left of the sternal border tricuspid, and fifth intercostal space mid-clavicular line, the apex or the mitral of the heart. And I'm listening for a strong S1 and S2. And you can go ahead and lean forward a little bit for me to pull that thorax towards the anterior portion. Okay, great. And stay forward for me. I'm going to go ahead and listen for murmurs at the second intercostal space left of the sternal border, the third intercostal space left of the sternal border, fourth intercostal space left of the sternal border, and the fifth intercostal space mid-clavicular line. I'm going to go ahead and flip the bell of my stethoscope. Okay, no murmurs were heard. So now we're going to go ahead and do check for jugular venous pressure. I'm going to have the patient lay back to 30 degrees. So you can go ahead and lay back. All right, I'm going to have you look to your left, assessing the right side. So I'm looking for the external jugular venous pressure, the highest point of the meniscus right here. I have something flat to help me measure and something with centimeters on one side. I'm going to go ahead and lay this there. I'm going to measure. And it should be 3 to 4 centimeters, and his is right at 3, which is great. All right, so now I'm going to have the patient lay supine. I'm going to take this pillow out. Now you can just lay on your back. We're going to go ahead and move on to the abdomen. First, I'm just doing a general inspection of the abdomen. I'm looking for bruising around the umbilicus. I'm also looking for any masses, pulsations, peristalsis, and any type of abnormal pulsations as well. Now I'm going to listen to the bowel sounds. His bowel sounds are normal active, so now I'm going to listen at the abdominal aorta and the femoral arteries just for any whooshing or bruise. No bruise or whooshing sounds were noted. All right, so now I'm going to percuss systemically over the abdomen, listening for any signs of dullness over any organs or full bladder. Okay, great. And so now I'm going to percuss right at the umbilicus, all the way up to the bottom of the liver border. And then I'm going to go from the clavicular line right underneath the nipple to the top of the liver border. Okay, great. And now I'm going to percuss for splenic dullness. Okay. And now I'm going to do a light palpation. I'm just going to be looking at the patient's face, just assessing to see if he has any pain with grimacing. Maybe feeling for any masses that could be located throughout the abdomen. Okay, and now we're going to move on to deep palpation. I'm going to place my left hand under the patient's back, and I'm going to be palpating the liver. So if you can take a nice deep breath in for me, let it out and relax. I want him to feel a smooth liver, and I do feel his, and it is smooth. Now I'm going to do the other side, and I'm going to be deeply palpating for the spleen. And I do not feel this patient's spleen. I'm going to move on to the kidneys. Take a nice deep breath in, let it out. Okay, and we'll do the other side. Nice deep breath in, let it out. Okay, perfect. And tenderness in the kidney area may indicate some sort of infection. All right, so while we're laying down, I'm going to go ahead and ask the patient a few questions. So I'm just going to make sure have we had any type of difficulty urinating, any dribbling urinating, pain urinating, or discharge.
No.
Okay. Since this patient is 30 and he does not have a family history of prostate cancer, we would not need to do early prostate screening. So we'll just move on from that. If he had any of those other symptoms, we would assess for that. He also needs to be assessing for any type of tenderness in the anal area, any type of masses that he may feel, anything abnormal down there, we would assess that, and he would have let his provider know. So now we're going to go ahead and we're going to assess for herniated disc. So I'm going to have you extend this leg, and we're going to dorsiflex the foot. Do you feel any pain?
No.
Okay. Now I'm going to do the other one, extend this leg, dorsiflex the foot. Any pain? Okay. So now I'm going to have you extend both legs, dorsiflex the foot and pull against my fingers, and push against my fingers, plantar flex. Okay, great. Now we're going to do range of motion of the hips. So I'm gonna have you extend this leg again. We're gonna extend, and then we are going to do flexion. We're gonna do, abduction, adduction, and we're gonna do external rotation and internal rotation. Now we're gonna move on to the other side, extend this leg. And then we're gonna do abduction, adduction, flexion, external rotation, and internal rotation. Okay, so we're going to do the knee while we're here. So we're going to do extension of the knee, flexion, abduction, and adduction. Okay. On this side, we're going to do extension of the knee, flexion, abduction, and adduction. All right, and you can go ahead and sit up. We're going to move on to the shoulders. All right, so I'm going to have you do abduction of the shoulders, adduction, come in and cross inward. We're going to do external rotation and internal rotation behind the back. Okay, you can relax those. Now we're going to do the elbows, range of motion of the elbows. So if you can just push up against my hands. You can just push up against my hands. Okay, great. And we'll test grip strength while we're here. Go ahead and squeeze my hands. No signs of atrophy were noted. All right, so now we're going to do range of motion of the wrist. So I'm going to have you supinate and pronate your wrist. Now do it really fast. That's testing cerebellar function with rapid movement. I'm going to have you hold out or extend out your knuckles and then bring them in, extend, bring them in. Okay, great. All right, so now we have already assessed the temporal pulse, the carotid pulse. We're going to do the brachial pulses, the radial pulses, popliteal pulses, posterior tibialis, and dorsalis pedis, ensuring that these are 2+ and normal. All right, so I'm going to do them bilaterally. Radial, popliteal with both hands. Posterior tibialis. Dorsalis pedis. While I'm down here, we're going to do proprioception. So I'm going to have you look straight ahead and just tell me which direction I move your toe.
Up, down.
Okay. And then also while I'm here, I'm just going to be assessing the nail beds for any sort of clubbing on the fingers and the toes. I'm also going to be assessing the lower extremities for moles, nevi lesions. I'm also looking for varicose veins, and I'm looking at hair distribution and coloring. Hair distribution is equal and even on both sides. Coloring is good with good risk capillary refills as well. All right, so now we're going to do a few cerebellar tests. So I'm going to have you open your hands up. I'm going to have you close your eyes, and if you'll just tell me which number I am writing on your hand.
Okay. 0. 1.
Okay, we're going to do some object identification. So I'm going to place something in your hand, and if you can just tell me what this is.
Okay. A pen.
Yes, that's right. Okay, you can open your eyes now. So now we're going to do reflexes. We're going to do the triceps reflex first. So I'm going to have you put your arm out like this and relax. Okay, we'll do the other side. Put your arm out and relax. Okay. That's the triceps reflex. Now we'll move on to the brachial radial. Hold your hands out like this. And if you can just relax this pinky. Just make sure we're relaxing the pinky. We're going to do the popliteal. So scoot back a little bit for me so you can have your legs dangling. Okay. All right, so we are going to do the Achilles. Okay. All right, so now I'm going to have you go ahead and stand up. And if you'll just stand right here and you can close your eyes. So right now I'm assessing the Romberg's test, which is assessing for balance, and this patient has good balance. All right, so now you're gonna go ahead and walk over this way, heel to toe, which is tandem walking. Okay, and go ahead and come back. Okay, you can turn around now. All right, so now I'm gonna have you face this back wall and go ahead and touch your toes for me. Right now I'm just assessing the spine. I'm looking for any abnormal curvature which could indicate scoliosis. I'm also assessing the SI joints. Go ahead and come up halfway. Okay, I'm looking at the curvature of the spine and it looks straight. With scoliosis it would be curved and his is not. I'm also assessing the SI joints at this moment. Okay, you can stand up. All right, so that is the end of the head to toe physical assessment.